Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my strap, put on the beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, now I'm running. You don't wanna follow me, I'm not fucking.
What's going on? What's going on? Good evening and welcome to another broadcast of Steve the Kidney Nurse. I am your host, Steve Belcher. Wow, thank you for joining. I want to thank my TikTok crew. They always come through. It doesn't matter if it's 1 or 50. They always there and support. So thank you, TikTok crew, for sticking around and watching the show. I know it's a Friday night. There's a lot of other things going on in your lives, or you're probably on social media looking at videos after videos. But let me tell you, if you happen to see this feed right now, you don't have to be a kidney dialysis warrior or someone that got diabetes or hypertension or any chronic illness to get Mrsa, okay? You could be a healthy person walking around, and if you fall or maybe you cut yourself by mistake on, say, a gate or some bleachers or something that has a piece of edge sticking out and you don't see it. Well, let's say you go down to the beach or you live near a creek and you on the rocks trying to mess with the water, the stream coming down, and you slip and you cut maybe the bottom of your foot or your leg, and that water has some type of bacteria in it, that stream, and now you got an infection. So don't think you got to be a kidney warrior or someone with a chronic condition to get Mrsa. It's just unfortunate that kidney patients are susceptible to it because of their in and out of the hospital or the dialysis clinic or maybe a nursing home. So that's why they're susceptible to it, but anyone can get Mrsa or any other type of skin bacteria or even viral streptococcus or whatever. But tonight we're talking about Mrsa. You'd be like, Steve, what's Mrsa? I always hear this, Mrsa, Mrsa this, Mrsa. I even had Mrsa. Not me. I'm saying, talking in the third person, that somebody else may say, like asking me, like, what's Mrsa, Steve? Because I had it and no one told me what it was. All I know is they told me I had to sit over here, and you got staff come to me with the gown on and some gloves and a different stethoscope, treat me kind of differently than they treat the other patients. So what is this Mrsa that I may have had, Steve? So let me explain it to you. What is Mrsa? As that is the title of this show, pronounced MER hyphen SHA, Mrsa. Okay? It stands for methicillin resistant Staphylococcus aureus. And that's where you get the M, R, the S for staph, and the A for aureus. Be like, God damn, Steve, what is, like, you talking about some methicillin Staphylococcus aureus, and you know, you may have some people on here that took microbiology, science, and they know what it is. They're like, oh, Steve, go ahead, keep on going. I know what it is. But for the people let me just break it down for you. Staphylococcus aureus, often referred to as staph, is a type of bacteria that is often present on the skin or inside the nose of healthy individuals. Remember earlier, guys, when I was on live, I said everyone has staph in their nasal flares right there. And that's why when you go into the hospital, they do a nasal swab for Mrsa. If, however, these bacteria get under the skin, we're talking about the staph bacteria, gets under the skin, and infection can occur, bar none. You can get an infection. That's why you see people, have you had a boil? Sound off. TikTok. Have you guys ever had a boil like under your leg or in between your groin area or in your buttocks or under your armpit? And you put hot water, you sit in the tub, and hopefully it'll come to a head and the infection will ooze out. Almost the same thing. And you probably wonder, what the hell is this? This is a boil. Why am I always getting this? Why am I always getting it? So an infection can occur if staph gets under the skin, the bacteria. Now, bloodstream infections or septicemia, right? Urinary tract infections and pneumonia can also be caused by staph. So staph can cause a lot of havoc. It can cause a lot of havoc in your life. Now let's talk about methicillin. That's the M, methicillin, in MRSA. Methicillin is a type of penicillin. That's all it is. It got the last part of it. Cillin, methicillin, penicillin, amoxicillin. That's all part of the penicillin family or the certain type of antibiotics. That classification. So methicillin is a type of penicillin. It was developed in 1959, but later replaced by other penicillin forms. So the word resistant, we know what resistant means. He's resisting arrest. The word resistant means that bacteria will no longer be killed by an antibiotic. Okay, so basically, MRSA is therefore a Staphylococcus aureus organism that has become resistant to all penicillins. Boom. That's what Mrsa is. Is a Staphylococcus aureus organism or bacteria that has become resistant to all penicillins. When you try to treat this with a penicillin, it's not going to heal it. That's why they got to use another type of antibiotic to kill it. That's why it's hard to treat, because it's resistant. It's resistant. So who gets MRSA? Who gets it? Like I said, anyone can get it. You don't have to have renal disease to get MRSA. So you see the TikTok live or social media, you see the post about MRSA, what it is. It behooves you to take out 45 minutes or an hour out of your life to see what it is from a health personnel perspective. Yeah, you can look it up. You can Google it. But if you don't understand medical jargon and you reading and you're like, shit, what is methicillin? What is an aureus? Also, what is a damn staphylococcus? Okay. You know, you want somebody who able to like decipher that information and break it down to the simplest terms possible. Weed out the other bullshit and get down to the nitty gritty of what you need to know. Just like that with the nursing, with nursing classes. Got a freaking nursing book as high as Mount Everest. You walking around campus, fucking book this thick. The nursing foundation book, this thick. You walking around with this heavy shit, like, damn. And all through it, it got redundant information. The same information you read on page 22, you see it down in page 1000 something. So learn the information, even though you don't have kidney disease. Learn it and then go back to the content creators that you like or you want to see that, you know, takes your mind away from reality. Because if you deal with this condition or you get it, once you turn off TikTok, turn off your phone or whatever, you still got the condition. And the other content creators are still doing what they're doing. Have a bowl of worms, faking like they're getting ready to eat it. Faking like they get ready to eat the worms or the maggots. And you eat people scrolling down, eat it. Or just like on TikTok. Have you ever heard that guy, Randall B. Gillis? He was on with Judge Karen. I mean, yeah, it was hilarious. But at the end of the day, education still has to be taught out there pertaining to these problems and conditions that one may not understand that has them. So who gets MRSA? Okay, who gets it? You may be, Steve, do I get it? Can I get it? Can I get it? Staph infections. Okay, staph infections occur more often in people with weakened immune systems. I feel like a preacher. Ha! Nah. But again, staph infections occur more often in people with weakened immune systems. So if you got a chronic condition, you fall in this category, bar none. If you got a transplant, any type of transplant, not just kidney, liver, heart, lungs, kidney. If you got kidney failure, if you got lupus, any chronic condition puts you more at risk of getting a staph infection. Because that's what Mrsa is. It's a staph infection, but it's a special type of staph infection that's resistant to the normal antibiotic regimen. People or persons with chronic illnesses are more often to get this, such as diabetes and kidney failure. Oh, Lord, let you not have diabetes, advanced stages of diabetes, and you get a staph infection on the bottom of your foot or your leg that won't heal because you got PAD, peripheral artery disease. Now what? It could be a possibility of getting infection because that infection can spread. Or as they say, become necrotic. Be like, Steve, what's necrotic? Remember that bacteria eating flesh, nephrocritizing the eating bacteria flesh? And you see people in the hospital, limbs cut off, hands and stuff. Because that damn bacteria, they can't stop it. According to the CDC, the Center for Disease Control, MRSA infections are seen more commonly in healthcare facilities such as hospitals. So the more you're in a hospital, the more you're at risk of getting a staph infection. Nursing homes and dialysis centers. He's like, how I got to do in a dialysis center? What if you go to a clinic and they don't clean their chairs out? What if they don't wipe the chairs with bleach? You may be a patient watching this over in Kenya, Zambia, or some country that may not use bleach to clean their chairs. Dialysis is not just here in the United States. This disease is global. It's global. So when a MRSA infection originates, so when this infection originates outside of healthcare settings, like if you get this infection in the woods or in the hood or in the suburbs you may live, or up in Hollywood Hills, or maybe in Dubai, or wherever. Because you don't think because you may got all this money, you may be in Saudi, the Grand Prince or whatever, or you up in Hollywood Hills, $20 million home. You just saw that actor, I don't know, I think it was a Marvel actor, messed up his feet. I think he was cutting grass, snowplow, some shit that happened. And he fell and he messed up his feet, may have to get an amputation. So you can have no money or you can be rich and still get an infection. So when this infection occurs outside of the healthcare setting, it is known as a community acquired MRSA infection because you got it in the community. You got it down Jacksonville, Florida at the beach, Pebble Beach or some shit. Or he was in Louisiana in the swamps hunting for catfish. And you scraped yourself on the leg in the swampy water. And next thing you know, you go home and the next day is red as hell and the infection is spreading up your leg. And you're like, what the hell just happened here? Yeah. You got a bacteria eating flesh. So now with this form of MRSA, skin infection, we may see pimples and boils. So I know well somebody's watching this live, whether it's on TikTok or on YouTube and Facebook, or you see this after the replay, that you may have had some pimples popping up on your skin or legs. Or be like, oh, that's just heat bumps. Or you may have had a boil on your butt. And you know how it is, you sit down, like, what is that? And then you get a mirror and you're looking under your leg and you push it and you feel this like a knot. Ouch, ouch. And you're like, oh, let me try to lance it. Let me get the drink, or let me sit in the tub. And next thing you know, you make it more worse. Now you're in the hospital because you got an infection that's spreading up your leg from a boil. So if you do find yourself seeing some pimples or boils, you make sure you go to urgent care or the nearest emergency room and figure out what the hell is going on. They often look like this. Wait a minute, let me take this down. So they often look like this. All right. So this is how they form, and it can get really bad. It can be really bad. Okay. It can be really bad. So you just want to be careful. If you find yourself in this situation, top of the foot, right? Top of the foot. Then it can spread. See how it's spreading? So you just, if you start to get any type of pimples or boil, don't try to get a like a pin, like a bobby pin or something, and try to burst it, because you can make it worse. Now, wait a minute, where is it? So, okay, let's say you're like, Steve, can this be prevented? Like, God damn, man, you threw a lot on us. Can it be prevented? I showed you some mild cases to the worst case. Okay. Staph aureus infections are more likely to spread from person to person if close skin to skin contact is present, hygiene is poor, living conditions are crowded, or skin is not intact, meaning as seen with cuts, abrasions, or at the catheter exit site. Like, Steve, what do you mean catheter exit site? Like, if you got one of these, it got to go, the exit site that it comes out of. Okay? So again, Staph aureus infections are more likely to spread from person to person if close skin to skin contact is present, hygiene is poor, living conditions are crowded, or skin is not intact, as seen with cuts, abrasions, or catheter access site. So to help avoid a Mrsa infection, this is what the CDC recommend, not Steve the kidney nurse. Okay? This is what CDC, Center for Disease Control. If you got your own remedy, your grandma salve, salve or whatever, I don't know. But this is what the CDC recommends, and what they call evidence-based information. It's been tested and tried. Maybe not grandma salve. So to help avoid a Mrsa infection, 1, keep your hands clean by washing them thoroughly with soap and water. Hand washing is really important. That's why I say, if you had dialysis, ask these people, are they washing their hands? All right, not just always using hand sanitizer. Soap and water is the old-fashioned way, and it's the most best way. And at least for 20 seconds. Wash your hands and then lather it up. And then you want to go all behind here, your wrist, between your fingers, your nails. You want to make sure you lather up really well. I don't go for them on that bull crap either. But on the education, some of the education, CDC, the education is what they've been using and what they use in the dialysis clinic. So that's what I go by. But I'm the last person to trust them when it comes to vaccinations and all that other stuff. But when it comes to education and about Mrsa and me getting education, so help you understand what you're dealing with, yeah, I use CDC, bar none. And not just them, but other credible information when it comes to education and teaching. I don't mess with them for that other stuff. Okay. Also, keep cuts and scrapes clean and covered with a bandage at all times. That's what's the word I want to say? That's what's the word? Um I mean, that's what you want. Bar none. Keeping cuts and scrapes clean and covered with a bandage until healed. Yeah, you don't want to walk around with no bandage on a cut or a scrape that could possibly get infected. That's without doubt. You got some people walk around that don't have no bandages on. I've seen it. And those are ones that are most at risk, especially if you don't keep your hygiene up. We talk just like with some of the homeless population. Avoid contact with other person's wounds or bandages. Somebody may be trying to have a friend or a loved one or whatever, and they trying to clean their wound with no gloves on. Oh, let me get this for you. And their hands can be infected. They may not wash their hands. Now they're trying to clean somebody's wound with their bare hands. Avoid sharing personal items such as towels or razors. What if you're in the military and or you don't even have to be in the military. What if you go on the trip? We just say military because these guys sleep in the barracks and the shower. I don't know. That's how it was with me. So say if you like, damn, I don't have a razor. Can I use yours? But I'm just saying, if someone decide to use someone else's razor to shave their legs or some shit like that, the women, some guy want to manscape or ladyscape or whatever, and using somebody else's razor and you nick yourself, you can get an infection that way. So avoid sharing a towel. You don't want to use someone else's towel. Oh, let me use your towel, man. You're at the beach. Let me use that towel. Let me wipe myself off. Hell no. They could be wiping between their legs and their behind, and they give it back to you. Avoid dialyzing with a hemodialysis catheter. They say that, but that's highly unlikely for a lot of people who ran out of accesses. And the reason I want you to do that because now you're prone to infection because the staff, when I say the STAFF, the staff at the dialysis clinic are not washing or changing their gloves, can put you at a serious risk of getting a staph infection. If a dialysis catheter is in place, as I said earlier and before, wear a mask during put on and takeoff. And the reason why, because if you got this in and when they open these caps up and you ain't got the mask is down like that, they can breathe their germs into here. Or when you got this uncovered and you got inside and ain't got that down, it could breathe right over the site. Yes, that's why I seen some patients that had this. They said, nah, say, Steve, I clean it myself. I do it when I get home. I say, okay. I got the supplies at home. Long as they understand how to do it and the risk and the consequences. Because they can still do it at home and get an infection, especially if they're not being careful. Also, at the end of treatment, when holding, if you got an access in your arm where they got to pull out the needles, when holding your access site post-treatment, wear a glove if you're not already wearing one, okay? And remove it after you get up from the chair. And then wash your hands. Simple. But has a big impact if you're not really adhering to you because of an infection. And so can Mrsa infections be treated? Yes. That's the good news. It can be treated. Antibiotics other than penicillins. Remember, methicillin is resistant to other penicillins, so they got to use antibiotics other than penicillins. That's where you may see, Ansef, or vancomycin, or gentamicin, or ceftazidime. So you can use other antibiotics other than penicillins to treat Mrsa. However, let's make no mistakes. Treating these infections, however, is sometimes difficult. You may have some warriors watching this right now and say, I remember when I had Mrsa and it was difficult to get rid of, but thank God we got rid of it. It may require special antibiotics. Also, successful treatment may take longer. You may be dealing with this for 3 to 6 months. And you're like, wait, what's going on? What's going on here? So, following measures to avoid infection is, of course, the best approach. It's the best approach. So if you're at home, if you want to say, man, I want to try to, stay free of this, you may be asking, what should I use to clean to prevent Mrsa from spreading? Say if you have it. So when you cleaning and disinfecting, focus on surfaces that frequently contact people's bare skin, like a desk, chairs, benches, gym equipment. You can go to the gym. And if you don't wipe down the stuff, the equipment, they got the disinfecting stuff, paper towels. You can have a little scrape of something go on your arm. You cut it or something. You scratched it. And now you're on the gym equipment. And you didn't clean it off. Someone else just came off. You come on. Then 2 days later, the damn area is red and it's warm to touch. You're like, what the hell is this? Not remembering that you was at the gym and didn't even wipe the equipment off. So, gym equipment, lockers, faucets, light switches, and remote controls. And in particular, clean any surface that could come in contact with uncovered wounds, cuts, or boils. All right. You may be at a college dorm or anywhere where you got multiple people coming through. And as I mentioned about infection control, when you go to dialysis or wherever you go, and you got to open the door, hundreds of other people open that same door behind you. Are you still carrying hand sanitizer like people were doing when COVID first came along? I mean, germs were here before COVID. They're going to be here after COVID. And people wondering how they get COVID. I got COVID. I don't know how I got COVID. Shit, if you touching door handles, if somebody else may have COVID and they coughed in their hands or some shit and they open the door, now they spreading it. And you're not thinking, you walking, open the door. Like today, guy asked me, I was on TikTok Live, why I got a mask on outside. Probably be the same person that asked me why I carry hand sanitizer in my backpack. That's why I work with multiple patients inside and out the nursing home. It's halfway through the freaking winter, and I haven't caught COVID yet. And I'm not trying to jinx myself. And I just had one vaccine. I ain't go back for no booster. And I'm not. That's my personal choice. And I had to really use the process of elimination to do the first one. Because I'm living with my mom. And so I want to respect my mom. I'm not going to go work in a nursing home and work around chronically ill patients and put myself at risk to get COVID and bring it back home to my mom at 93 years old. Yeah, I'll sacrifice to get the shot if I'm not going to pass it to her. But it's like, damn if you do, damn if you don't. We got to die one way or the other. Okay, we're not here forever. We always got to remember that. Whether you got kidney disease or any chronic illness or not, we all are going to leave this earth one day. I don't care who you are. I don't care if you're a billionaire Or you in the slums of Calcutta, India. No one lives forever. It's like what you do with your life and the conditions you're dealing with while you're here. And you just may be a person that's got Mrsa. How I heal that. So if you want to clean these um, surfaces or whatever, or even when you go places, one, even get a box of gloves and use it when you open the door or wherever you got to touch that other people touch, or get some bleach wipes in a packet and wipe the door handle off before you open the door, especially in the dialysis unit. You know how many people walk in and out of the dialysis unit? Transportation ambulance guy, they got the gloves on when they taking the patient from the nursing home and bringing, and he touching the door. Now somebody else coming in touching the door. It ain't like the dialysis people go out there and clean a handle off at the end of the day or after someone touches it. So you wonder, like, how did I get COVID? Yes, just look at the stuff that you touch. We done got lazy, let our guards down. And it's understandable. But don't forget that germs were already around even before this damn pandemic came. The pandemic just made you look at what can happen when shit hits the fan. So use bleach. That's what we use in the dialysis unit. We mix a certain amount of bleach per parts water. And then we got the rags. If you're a patient at dialysis, you know the rags, the white towels I'm talking about. They want, hey, can you give me one of them towels so I can blow my nose or wipe my hands? You know what I'm talking about. We use them, put it in the bleach, squeeze it out, and wipe the machines down. Wipe the chairs down. If we have a blood spill, we wipe it up with the bleach rag. Or we got a hepatitis patient, we use a bleach rag to wipe the hepatitis machine down in the chair, or if there's any blood spills. You can't go wrong with bleach and water. And one more thing, Mrsa can cause severe problems. Yes, it can cause bloodstream infection, pneumonia, and surgical site infection. What if you go in a hospital to get surgery on something? What if you go get kidney transplant? Or what if you're the donor and they mess around and they use some tool that wasn't sterilized? And now you got an infection at your surgical site that won't heal. And you the donor. And you didn't expect none of this. You thought it was going to be a clean cut. I'm going to donate, get out, boom. But no, you got an infection and it's serious. And you're like, and the person that got your kidney, they out the hospital living life. You know, no, I'm not like saying, you know, that this could happen. But it could. You're the donor. That's one of the risks with surgeries. And that's not the average. The average, everything is good, successful. You go home, live your life. But there's another side. Let's make no mistakes. There's another side, a side that people don't often talk about, especially if something happens to the donor. And this is what I said, where if they pay people, had a fund set up, and they paid donors $250,000 to donate, and it was controlled under an agency, then maybe the person wouldn't be so salty if they got an infection because of some unclean tools, but yet they had $250,000 for the compensation. So that's my talk on Mrsa. Again, Mrsa stands for methicillin resistant Staphylococcus aureus, and is therefore it's a Staphylococcus aureus organism or bacteria that has become resistant to all penicillins. And so they just got to use a different antibiotic to treat it. And again, you just want to avoid surfaces with your bare skin or where you may have a cut somewhere. You want to avoid having contact. Okay? Hold on. So with that being said, I'm going to end this live. And if you want to talk, I'll be on TikTok. But I want to end the live for YouTube and Facebook. And wait a minute, let me go through the comments right quick. Hold on. I see your comment on the spironolactone. Oh, hey, look, Tasha, how you doing? Thank you. She said, can doctors give you meds for MRSA to take home, or you have to stay in the hospital until it's gone? You may can get like vancomycin in the pill. So no, they could probably treat you outside the hospital. Yeah, they can. They can. Because I know patients who had it and they came to dialysis and we gave them like antibiotics at the treatment center. They wasn't in the hospital. And yeah, it is. You asked, is it contagious? Not contagious, but if you like you got an open cut on your finger or your hands, or like with boil, like between your growing area where it's moist at, you know. So no, it's not contagious, but if you touch somebody's wound where it's at, and then you touch yourself in the wound or open mucus, you can spread it that way. So, oh, you're welcome, Latasha. So with that being said, I'm going to shut down the YouTube and Facebook feed. I want to thank you guys for watching. I want to answer this young lady's question about the spironolactone and go from there. So thank you guys for watching. God bless you. And I'll probably be back on tomorrow with a different topic, because this is a kidney disease educational moment. All right. So thank you guys. God bless you. We see you on the other side. Peace.
around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't caught gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my strap, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, and now I'm running. You don't wanna follow me, now I'm fucking